Hi, welcome to the conversation. This is Women's Health Wednesday. Of course, we have in studio with us the always wonderful Dr. Madeline Sawyer, OBGYN, a noted surgeon and women's health advocate and provider here in the Bahamas. Dr. Sawyer, today we're talking about urinary tract infections, specifically in women. We know men can get them as well, but women are more susceptible, yes?
More common.
It's more common in women?
More common in women, yes.
Yeah, certainly. And really, it's an interesting conversation just to learn about this. You hear about it, it's common, but do you really know what a urinary tract infection is? And Dr. Sawyer, that is the question I'd like to ask you. What is a urinary tract infection?
Well, Shanique, a urinary tract infection, most places when bacteria get into an organ and creates an inflammation. And because of the way the urinary tract system is, you can have what's called a lower urinary tract infection involving the bladder, where bacteria get into the bladder and you get problems with that. And then more dangerous and more concern is when bacteria get into the kidneys themselves, which is high up in the back of the abdomen, and cause an infection and cause damage to the tissue of the kidneys, which can, if not treated aggressively and becomes chronic, can damage to the kidneys to the point of them not being able to function and the person ending up with dialysis.
And now that these are the summer months, Dr. Sawyer, I mean, how much should we be drinking, taking in water to assist with kidney and also to kind of keep us flushed and healthy?
Very important, because we're losing in the heat and humidity, especially in our country, in the Bahamas, you lose a lot of liquid through the skin, through perspiration and so on. So a lot of people suggest about 6 to 8 glasses of water. I try to get people to monitor with their intake by looking at the color of the urine. If the urine is very dark, it means it's concentrated, you're not taking in enough. If it's very light, almost like water, it means you're taking in perhaps a little more than you need. So you want to keep your urine the right color, which is like a light straw colored, light yellow. And if you drink enough to do that, then you're keeping up.
This is The Conversation. Listen, subscribe down below and continue watching. Thank you so much. Have a great day.
That's nice.